This is how Health Mirror works. In the typical family practice office, a patient enters the office, and then after checking in with the front desk or perhaps with a check-in kiosk, the nurse brings the patient back to the exam room. As the nurse enters the appropriate selections, she then sends that information to the Health Mirror server. The server then queries our database of health content, which then sends appropriate multimedia health content to the touchscreen device in the room which the patient is waiting in. With an EMR integration, most if not all of these steps could be captured by querying the EMR database for information. Hopefully, with this type of integration, the nurse's role will be minimized if not eliminated. Prior to any interaction with the staff interface, during the setup of the Health Mirror content, practice and each physician can prioritize the content according to what pieces of content they feel are most important for their patients to hear and to understand. The multimedia content that Health Mirror currently uses is from existing health content providers such as Healthy Roads Media and Milner Fenwick. Health Mirror also allows a practice or physician to create their own content according to their needs. In the Health Mirror display in the exam room, multimedia videos are presented in categories of information. Patients are able to select categories that they are interested in. If they don't interact with the mirror, within about a minute, a voice prompt comes on. If after the voice prompt they still don't interact with the display, then content is shown according to the pre-established priorities set by the practice and the physician. Typically, after a provider or nurse enters the room, they may pause the display, and then when they leave the room and leave the patient alone in the exam room, they'll unpause the display and allow the health content to be displayed and utilized by the patient. The video viewer has navigational features, a volume control, and a mute button, all from the touchscreen interface. If the patient wishes to take the information they've seen on Health Mirror home with them, they have the option on the touchscreen to send an email to themselves with a link to the session ID of the content that they had just seen. Alternatively, using a QR code scanner, they can display the content on their smartphone. Health Mirror also has a reporting function. This allows a practice or physician to see how Health Mirror is being utilized in the exam room. Reports can be generated to show what type of content was displayed and also what type of content was interacted with by the patient. We look forward to having you utilize Health Mirror as a tool to enhance patient education. This utilizes a time the patient is waiting for the physician to enter the exam room, fueling the patient-physician encounter that's about to occur, with engaging patient educational content relevant to their demographics and diagnoses.